Hey everyone, welcome back. Ready for another deep dive. Today we're going to be talking about something that's absolutely fundamental to understanding psychedelic experiences. Set and setting.
Yeah, it's a topic that often comes up.
You always hear people talking about it.
Yeah.
But I think it's worth really digging into, like what it actually means and how it plays out in the brain.
Absolutely. It's definitely more than just, like having good vibes or a comfy couch.
Right. Okay, so let's start with the basics.
Okay.
What exactly do we mean when we talk about set and setting? And why is it so important in the context of psychedelics?
So think of set as your internal landscape going into the experience, like your mindset, your mood, your intentions, your expectations, all of that.
Got it.
And setting is, it's everything external.
Okay.
The physical environment, the people you're with, the music, even the cultural context can be part of the setting.
So basically, it's like the internal and external factors that kind of create the stage for the experience.
Exactly, yeah. And these factors, they actually influence how psychedelics interact with your brain, like at a molecular level.
Well, wait, hold on.
Yeah.
You're saying, my thoughts and feelings can actually change how a drug works in my brain.
Yeah, that's what the research is showing.
Okay, I'm hooked already.
Yeah.
Let's get into the details.
Okay.
Where do we even begin with this?
Well, a recent study looked at over 1,000 psychedelic users in Spain.
Wow, that's a pretty big study.
Yeah, it was a large sample size.
Okay.
And it really highlights this connection between set and setting and the outcome of the experience.
Oh, interesting.
So, for example, people who went into the experience wanting to grow personally,
Okay.
and they were in natural settings with people they felt close to, significant others, they tended to have more positive outcomes from the psychedelic experience.
So what does that mean, like positive outcomes? Like what were they actually reporting?
Well, they reported, less psychological distress, a greater sense of well-being, and they said the experiences were just more meaningful to them.
That's pretty incredible.
Yeah.
So, yeah, I mean, this isn't just like anecdotal evidence anymore. Like we have data to support that set, and setting really matters.
Exactly. It's starting to become much more clear.
Wow. Okay, so what about the flip side? What about people who went into the experience, maybe not with the best mindset?
Yeah. So the study also found that people who were maybe trying to escape their problems or going in with, kind of problematic motivations,
Right.
they actually had more negative outcomes like increased anxiety and psychological distress.
Yeah, that makes sense.
Yeah.
I mean, if you're already feeling anxious or you're running from something, like a psychedelic experience might just amplify those feelings. Right?
Yeah, it's like you're bringing that baggage into the experience.
Right, exactly.
And it can make things more difficult.
Okay, so this is already kind of challenging my assumptions, Like I think a lot of people assume that psychedelics are, all about partying or just having fun.
Right, there's definitely a stereotype there.
Yeah, but was that actually the case in this study?
Not really. Fun-seeking wasn't the primary motivation.
Really?
For most people, yeah.
So what was the main reason people were using psychedelics?
It seems like self-knowledge was the top motivation.
Wow. So people are really using these substances to explore their inner worlds.
Yeah.
And try to understand themselves better.
Yeah, that's what the data suggests.
Okay, so there's a lot more depth here than we often give it credit for.
Yeah, there's a lot going on beneath the surface.
All right, so let's dive into the brain science a bit.
Okay.
Earlier you mentioned these receptors, the 5-HT2A receptors.
Yeah.
Can you remind me what those are and how do psychedelics actually affect them?
Sure. So 5-HT2A receptors, they're a type of serotonin receptor in the brain.
Okay.
You can kind of think of them like little docking stations on brain cells.
Docking stations, okay.
And psychedelics, they bind these receptors, like the molecules actually attached to them.
Oh.
And when that happens, it triggers a cascade of activity that changes how the brain processes information.
So it's like the psychedelic comes in and kind of flips a switch in the brain.
It's more like it turns up the volume on certain neural circuits. And those circuits are involved in, how we perceive things, our emotions, even our sense of self.
Wow. Okay. So we've got these receptors. And psychedelics are turning up the volume on certain parts of the brain. But how do set and setting fit into all of this? Do they somehow change the receptors themselves?
Not directly, no. It's not like they're altering the structure of the receptors. It's more about how they influence the overall brain activity that's happening, in conjunction with the psychedelic.
Okay, I need an analogy here, I think, to really wrap my head around this.
All right, so imagine Imagine the 5-HT2A receptor is like the volume knob on a stereo.
Okay.
Psychedelics, they come in and crank up the volume.
Right.
But set and setting, they're like the equalizer.
Okay. So the psychedelic sets the baseline, but the environment and my mindset can fine-tune the experience.
That's a great way to put it, yeah.
Okay. That's starting to make more sense.
Good, good.
So for example, if I'm in a really calm, supportive environment, could that actually enhance the positive feelings I might experience during a trip?
Yeah, absolutely. Because those external cues, they're kind of shaping how your brain is processing those psychedelic effects.
Oh, interesting.
So the same dose of a psychedelic, could feel very different depending on the setting.
Wow, okay.
On the flip side, if you're in a stressful or chaotic environment, that could lead to more challenging experiences like anxiety or paranoia.
Even with the same dose?
Even with the same dose, yeah.
Wow, that's pretty powerful. So it's like the environment, adding another layer of information on top of what the psychedelic is already doing.
Exactly. And it's a complex interplay. We're only just beginning to understand all the nuances.
Yeah, this is blowing my mind. So, okay, we've got these receptors, and setting is like the conductor, kind of shaping the overall, symphony of brain activity.
I like that analogy, the symphony of brain activity.
Right.
Yeah. And that symphony can have a really profound impact on us, on our thoughts, our emotions, even our sense of self.
So it's not just about getting high. It's about the potential for really deep, psychological shifts.
Exactly. Yeah.
And even healing.
Absolutely. And that's why set and setting are so incredibly important in therapeutic applications of psychedelics.
Right. That makes sense.
Yeah.
Okay, so let's talk about that therapeutic side a bit more.
Okay.
What can we learn from clinical trials that are already using psychedelics to treat things like PTSD or depression?
Well, one really promising area is MDMA-assisted therapy for PTSD.
Yeah, I've been hearing a lot about that.
It's showing some pretty incredible results in the trials.
That's so cool.
Yeah, and a big part of the success seems to be tied to the therapeutic setting itself.
Okay, so it's not just a matter of giving someone MDMA and seeing what happens.
No, not at all. It's much more nuanced than that. It's about creating a very specific environment, an environment of safety and trust where the patient feels comfortable, really confronting those traumatic memories.
Yeah, I can imagine that's super important, especially with something as sensitive as trauma.
Right. You don't want someone reliving those experiences in a cold clinical setting.
Right.
So therapists use things like soft lighting, comfortable furniture, calming music, even the scent of the room is taken into consideration.
Wow, that's fascinating. So they're really trying to create a sanctuary, a space where healing can happen.
Exactly. Yeah. They're setting the stage for healing on multiple levels.
And I imagine the therapist plays a big role in this too, right?
Absolutely, yeah. The therapist acts as a guide, providing support throughout the entire experience.
It sounds like having that supportive presence is really key, especially when you're dealing with something as intense as trauma.
Yeah, it can make a huge difference.
This is really making me think about how we approach healing in general. You know, we tend to focus so much on the medical side of things, but it seems like the environment, our mindset, all of that plays such a huge role as well.
It's all connected.
Yeah.
Mind and body, it's impossible to separate them.
Right. And it seems like these psychedelic therapies are really highlighting that connection.
They really are, yeah.
This whole conversation is making me think about the placebo effect too, we know that our beliefs and expectations can have a really powerful impact on healing. Could something similar be happening with psychedelics?
That's a great question. And the answer is most likely yes.
Oh, really?
The placebo effect, it plays a role in all forms of therapy, really. And it's likely a factor in psychedelic therapy as well. When someone believes they're going to get better, their brain can actually start to change in ways that promote healing.
So a positive mindset can actually lead to physiological changes.
Yeah, exactly. It's pretty amazing, right? And in the context of psychedelics, that positive mindset combined with a supportive and safe setting, it could really amplify those positive effects. It's like you're priming the brain for healing.
Wow, that's incredible. But if the placebo effect is so strong, how do we actually know that it's the psychedelic that's causing the therapeutic changes?
That's where good research design comes in.
Okay.
Scientists use control groups and blinding techniques to try to tease apart those effects.
Okay, can you break that down for me a little bit? I'm not really familiar with those terms.
Sure. So a control group is a group of participants in a study who receive a placebo instead of the actual drug. And this allows researchers to compare the outcomes, between those who received the drug and those who didn't.
So if the group that got the psychedelic shows a lot more improvement than the placebo group, then we can be more confident that it's actually the drug that's making the difference.
Exactly. Yeah. And then blinding, that means that neither the participants nor the researchers know who's getting the drug and who's getting the placebo.
Oh.
And this helps to eliminate bias.
That's really smart.
Yeah, so there's a lot of effort that goes into designing these studies to make sure they're really measuring what they're supposed to be measuring.
Wow, it sounds like a lot of work.
It is. It's very complex research.
Okay, we've talked about set and setting, these 5-HT2A receptors, the placebo effect. Anything else we need to consider when we're trying to understand these experiences?
Yeah, there's another really fascinating aspect of brain activity that seems to be affected by psychedelics, and that's the default mode network.
The default mode network, what is that?
So it's this network of brain regions that's it's active when we're not focused on a specific task.
Okay.
It's kind of like the brain's autopilot, you know? It's buzzing along in the background when we're, daydreaming or reflecting on ourselves or just letting our minds wander.
So when I'm zoning out, that's my default mode network.
In a way, yeah. And what's interesting is that psychedelics, they seem to disrupt the activity of the default mode network.
Disrupt. Is that a good thing or a bad thing?
Well, some researchers believe that a hyperactive default mode network might actually be involved in conditions like depression and anxiety.
Oh, interesting. So if someone has depression, this network is kind of stuck in overdrive.
That's the idea. And it could lead to, excessive rumination, negative self-talk, all of that.
Wow. And
psychedelics, by temporarily disrupting this network, they might be creating a window of flexibility in the brain that allows for new perspectives and insights to emerge.
So it's like you're breaking free from those rigid thought patterns.
Exactly. Yeah, it's like shaking things up and allowing for new possibilities.
That's really fascinating. So it's not just about the psychedelic creating a temporary high.
Right.
It's about potentially rewiring the brain in a more lasting way.
Yeah, and this disruption of the default mode network could be one of the key mechanisms by which psychedelics actually promote those psychological changes.
Wow, that's pretty amazing. It makes me wonder, could we train our brains to do that on their own, without psychedelics?
That's a great question. And it's something that researchers are definitely looking into.
Oh, cool.
Practices like meditation and mindfulness, they've been shown to modulate default mode network activity.
Oh, really?
So there's definitely potential for non-drug approaches as well.
That's really exciting. It seems like we're just scratching the surface of understanding how the brain works and how we can harness its potential.
We really are, yeah. And it's a reminder that the brain is incredibly plastic, incredibly adaptable. We have more power to shape our own mental states than we often realize.
I love that. Okay, so we've covered a lot of ground here. We've talked about set and setting, these 5-HT2A receptors, the placebo effect, the default mode network. It's a lot to process.
It is, but I think it paints a really amazing picture of the complexity and the potential of these experiences.
Yeah, it does. And it all seems to kind of circle back to the importance of set and setting. Right?
It does, yeah.
If these substances are really shaking things up at such a fundamental level in the brain, it makes sense that the environment and our mindset would play such a huge role.
Exactly, yeah. The insights and the shifts in perspective that can happen during a psychedelic experience, they need fertile ground to take root,
Okay.
And that ground is cultivated through set and setting.
It's like the psychedelic provides the seeds, but set and setting determine whether those seeds will flourish or wither.
That's a beautiful way to put it, yeah.
Right.
It really emphasizes that dynamic interplay between the subjective and the neurobiological.
I'm really starting to see how this all ties together. It's not just about the drug. It's about the context, the intentions, the support system. It's like a whole person approach to healing.
It is, yeah. And that's something that we often lose sight of, I think, in our modern medical system, which tends to be so focused on treating symptoms rather than addressing the root causes of things.
That's such a good point. It makes me wonder if, like, incorporating these principles of set and setting could actually enhance other forms of therapy as well. Even therapies that don't involve psychedelics.
Absolutely. Imagine, incorporating those principles into chronic pain management or traditional psychotherapy, creating a more supportive and calming environment, fostering a sense of trust and safety. These are all things that could potentially amplify the healing process, regardless of the specific treatment.
I love that. It's about recognizing that the mind plays such a powerful role in shaping our experience of illness and healing, and that we can actually create environments that support that healing process.
Exactly. It's about moving beyond that purely biomedical model and embracing a more holistic and integrated approach.
Yeah, this is all so fascinating. It feels like we're really on the cusp of a major paradigm shift in how we think about healing.
I agree. And the more we understand about set and setting, the better equipped we'll be to really harness the power of these experiences,
For good.
Yeah.
Okay, I have to ask, with all this talk about setting, like, are there any specific elements that seem to be particularly impactful? Like, is there a magic formula for creating the ideal setting for a psychedelic experience?
I wouldn't say there's like a magic formula because everyone's different,
Right.
Everyone's going to have their own internal landscape.
Yeah.
And sensitivities. But there are some elements that consistently seem to be really beneficial.
Okay, like what kind of things are we talking about?
Well, nature is a big one.
Nature, okay.
A lot of people report having really profound experiences in natural settings.
Yeah.
Forests, beaches, mountains.
Yeah, that makes sense. I mean, being in nature can be so, like, grounding and calming.
Yeah.
It's like you're connecting to something bigger than yourself.
Exactly, yeah. And that sense of connection, it can be really amplified during a psychedelic experience.
Wow, okay. What else? What other elements are important?
Music is another powerful one.
Music, okay.
I mean, music can really set the mood, right?
Oh, yeah, for sure. But I imagine it has to be the right kind of music.
Yeah, definitely.
Probably don't want to be listening to, like, death metal during a therapeutic session.
Right, exactly. The type of music can really influence the experience.
Okay.
So therapists often use, calming ambient music, nature sounds, things like that,
Okay.
to create a sense of peace and tranquility.
It sounds like it's all about creating a space where people feel, like, safe and supported.
Yeah.
To really go inward and explore their inner world.
Exactly, yeah. And that sense of safety, it extends to the people who are present as well.
Right.
Having a trusted guide or facilitator, someone who can hold space for the experience, that can make a huge difference.
So it's not just about the physical environment.
Right.
It's also about the social and emotional support.
Absolutely, yeah. All of these elements, they kind of weave together to create the overall container for the experience.
This is making me think about harm reduction as well.
Okay.
Like, we've talked about how set and setting can enhance the positive aspects, but can it also help to, like, mitigate the risks?
Yeah, absolutely. Understanding set and setting and really optimizing it, it's one of the most effective ways to minimize any potential risks.
Oh.
So, for example, if someone's feeling anxious or uncertain about the experience, having a supportive guide and a calming environment.
That can really help them to feel more grounded, more safe.
Yeah.
And that can prevent, like, those anxieties from spiraling into something more challenging.
Exactly. Yeah.
So knowledge is power, even when it comes to psychedelics.
Absolutely. The more we understand about these substances and how they interact with our minds and bodies, the better equipped we are to use them safely and responsibly.
We've been focusing a lot on the therapeutic uses of psychedelics.
Yeah.
But I'm also curious about, the non-clinical uses.
Okay.
Like, people have been using these substances for centuries for spiritual exploration, personal growth.
All right.
How does set and setting play into those contexts?
It's just as important, even outside of a clinical setting.
Okay.
The set and setting can really make a huge difference in the quality and the meaningfulness of the experience.
So what what should people be thinking about if they're using psychedelics for, more personal reasons?
Well, intentions are key.
Okay.
Like, why are you engaging with this substance? What are you hoping to get out of the experience?
So having a clear sense of purpose can actually make the experience more impactful.
It can, yeah. If you're using psychedelics for self-exploration, it's really helpful to go in with a sense of curiosity,
Okay.
openness, a willingness to, to really confront your shadow side.
Yeah.
And explore the depths of your consciousness.
And the environment still matters.
Oh, absolutely, yeah. Just like in a therapeutic setting, the environment you choose can really influence how things unfold.
So if I'm looking for profound insights, a rave might not be the best setting.
Probably not, no.
Okay, good to know.
Yeah, for those kinds of experiences, a quiet, natural setting, free from distractions.
No, that's usually more conducive.
This has been such an eye-opening conversation.
Good.
I feel like I have a whole new understanding of how important set and setting really is.
Yeah.
And it's not just some new age fluff,
Right.
It's actually crucial.
It's fundamental.
Yeah, it's fundamental to shaping the whole experience.
I'm glad you're finding it valuable. And remember, we're still just beginning to understand these substances.
Yeah.
There's so much we don't know, but with continued research and responsible exploration, we can unlock even greater potential for healing and growth.
This has been a truly fascinating deep dive.
I agree.
Until next time, keep those minds open and those questions coming.